The theme for this year is a very important one. They'll be able to explain a bit more.
This disease called malaria affects three main living things, I can say, living things. One living thing is the mosquito. One living thing is the parasite that causes the disease. And one living thing is the human being, us. So three living things are involved. The parasite is picked up from an infected human being by the vector, which is the mosquito. When it bites that infected person, it takes it across to a non-infected person. So that is how malaria is transmitted across from an infected person to a non-infected person. So the mosquito plays a very critical part in the disease transmission. That's why when we say controlling malaria, we want to control the mosquito. So we say vector control. Sleeping under the mosquito net, a treated mosquito net, is one part of one activity we do in vector control. There are other things that we also encourage people to do, and that is managing their environment. The mosquitoes breed around the environment. So we talk about environmental management, or we say larvicide management, that is trying to break down the breeding sites and breeding of mosquitoes. So that is another part of the activities that we encourage and request our implementers to implement. That is environmental management, apart from the LLI or the treated bed nets, we call it. So there is a vector control, there is prevention part of it, and then for those that have already had a malaria in their body, we have another part called case management. That is testing the blood of individuals and checking whether they have the malaria parasite in them or not. If they have it, then we treat them. So there is a prevention part in trying to control the vector from transmitting the disease from one infected person to a non-infected person. And then there is the second program part, which is the case management, treating the ones who have the disease in them. Now, malaria in the early 80s and 90s, going up towards the turn of the century, we were reporting in the tune of 1.8 to 2 million cases every year. Then around in 2004, 2005, external support to fight malaria came on board through support provided by what is known as the Global Fund. That has helped the program to procure free treated mosquito nets that is given to people all around the country at certain heights, below 1,600 meters altitude. So people living underneath that, the lower parts of the country, everyone was given a net freely. Rotary Against Malaria has done a fantastic job over those years. There were other organizations that helped, but Rotary is the main one that came in and then assisted the program to distribute, to buy and distribute these treated mosquito nets. So from 2006 up to about 2012-13, the number of cases was on a decline. Cases were coming down. People were getting better, reporting less numbers, sleeping under the nets, and they were practicing good habits with the use of the nets, as well as habits to look after themselves in their dwelling places and the communities. So the case numbers started coming down. And then around in 2014, 2015, something happened, and the case numbers started increasing. So there were studies done by our own PNG IMR to find out why this was, and then we later realized that some chemicals used by the manufacturers in the nets were not effective. It was reported to WHO and corrective measures being taken, and we are looking at that. So that's our fight for malaria. So it is more on malaria vector control.
We all need to understand that there is reasons why people are dying, even though we have facilities, treatments available at our facilities. Let me just mention a few things. One of the main causes that, people need to understand the symptoms, the clinical symptoms of malaria, and that's very important. We try our very best to advise or promote how, the symptoms of malaria. Okay, what are the symptoms of malaria? The common ones are basically chills, fever, all that, joint pains, we normally say. And there are other other symptoms that present early. So what we normally say is that, if you experience the symptoms, it's better to go early to the health facility, and you must see our health professionals available at the clinic or at the health facility. Many times people go very late. Okay, and that's because of our behavior mindset. People try to seek home remedies, home treatment, and people go, after they see that their case becomes so serious, they go to the hospital, and that is very late. So sometimes it's become very difficult for us to treat these kind of cases when the complications already been established. But sometimes with cerebral malaria, a simple malaria can lead to a cerebral malaria, which is a serious component of the malaria itself. So that is one of the major causes. And the other problem is that people don't sort of resort to the treatments or basically diagnostic tests that's available. We have those rapid test kits are now available. Even at the pharmacies, even at the facilities, you can be able to pick up those and try to test yourself, but to see that whether it is malaria or not. Okay, so those are some of the causes, and let me also say that the most affected group of people are basically the children and the pregnant mothers. Okay, they're more highly prone to malaria, and also due to some immunity issues. So we advise that the best thing to do is when you experience those signs and symptoms, it's better to go early to the health facility for you to be checked up and put you on treatment, so that will really avoid, developing serious complications and even to death as well.
Every year, a day is set aside and recognized to commemorate malaria as an important public health disease that affects many in countries around the world. PNG is one of them, and we take part in commemorating this international day because many of our people suffer from malaria one way or another. Papua New Guinea, being a tropical country, is recognized as one of the high burden malaria countries in the world. In the Western Pacific region, WHO divides the countries into different regions, and we, Papua New Guinea, come under a region called the Western Pacific region. Western Pacific region covers China, Japan, Indonesia, Australia, New Zealand, and Pacific Island countries. So countries within this region is grouped as the Western Pacific region, and PNG reports 88 to 90% of the malaria cases that are reported within this group of countries. That means we have a huge problem. We report around 1 million cases every year. For the past 5 or 6 years, our numbers, the number of cases that we are reporting from each of the health facilities, provincial hospitals, every place where patients, our people are getting treated, their reports are all sent to the National Malaria Program of the department. And we keep that report, and we are seeing that when we put together and then try to total up for a year, it's about 1 million cases every year. So for the past 1 year, has been like that. And that's why we are recognized as the highest burden malaria country in the Western Pacific region. We have a big problem. We'll all have to work together. Everybody will have to take ownership of this malaria issue and contribute towards eliminating malaria and improving our life.
Only NGO in the country which only deals with malaria, no other disease component, and we don't have any aspiration for other thing. So you can understand the commitment and passion of Rotary Against Malaria for malaria elimination in PNG. And every year we distribute something around 3.6 million treated mosquito nets. These nets are funded by Global Fund, which is based in Geneva, and PNG is a regular recipient of this fund since early part of the century. And we are now at grant cycle 7, and we are going to start grant cycle 8 from next year. So I must congratulate government, because government of PNG has given malaria a lot of importance. There are lapses here and there, but the most important thing, government has committed 16.8 million kina every year for malaria commodity procurement, which is a huge step indeed. That's number one. And government has already developed a new national malaria strategic plan for next 5 years, which is 2026 to 2030. And government also has, when I say government, it is National Malaria Control Program under Dr. Kisom's leadership. We also develop sub-national tailoring, meaning stratification, which intervention we should implement in which place. So I think these are the very positive steps, and what has not happened thus far is some new tools that we have never tested. So those new tools that will be required for PNG to manage malaria. Two things I will highlight. Whatever nets we distribute, these nets are to be used. So my appeal to the whole country, that when you get a net, it is an expensive commodity, although given you free, but you really need to use it consistently every night with your children, and that will really save you from malaria. And always everyone should keep their homestead tidy, no stagnant water. What Milne Bay, Autonomous Region of Bougainville is doing, Healthy Island, that everyone should go for early diagnosis and treatment. These 3 messages are critical. If you go for early diagnosis, early management, malaria will be managed.
Partnership we know is very important in a country like PNG, where we have a lot of challenges in our health service delivery system, as well as accessibility to resources. We are considered as a resource limited setting, and we have a health system that is not very strong or not so strong. It's considered fragile. So that's why we need partners. We need partners like WHO that comes in with technical advice on the best practices that can be applied in controlling malaria in here. We need partners like Rotary Against Malaria, where there are a lot of shortfalls in delivering malaria services in the country. They come in to assist the program in a big way. Many a times they go out on their own way to look for resources to contribute towards the work they are doing. And so partnerships in a disease program like this is very critical. Unfortunately, in this country, we do not have many, the luxury of many partners. So I personally like to respect partners that are helping us to help prevent the diseases like malaria. Wherever they are coming, wherever they are, we must respect their offices, their properties, and make them feel welcome. Assist them in what they are trying to do, and let's work together, because partners bring with them some things that we don't have.
Actually, Provincial Authority is very privileged to have many partners who are actually supporting us in terms of delivering public health programs in the city and also part of Motukweta villages. And malaria is one of the 14 public health programs that we actually conduct. Out of so many programs like TB, HIV/AIDS, maternal child health programs, disease control programs, lifestyle diseases. Malaria is also one of the very important key components, key programs that we actually provide in terms of awareness, in terms of screening, in terms of assisting our team to provide a treated bed net. So to have on board very important partners like the Rotary Against Malaria and WHO is a bonus to us in areas where we have issues with the capacity in terms of logistic support, in terms of technical advice. It is a privilege to have them on board to ensure that we all those the annual activities that we have for malaria are delivered, executed with our team members. So we really appreciate the team, especially our partners. They've helped us a lot. We have been running some of these programs together with them. So they've been very good in terms of supporting us, especially in terms of capacity and technical advice. So we have been together. So their support to us actually help us to improve on, especially in terms of case management, health promotional activities, even going to the settlements and providing awarenesses to the communities in terms of prevention, the clearing of the pools and all those water collections. Those are some of the activities that we normally do. And what we are actually doing now is basically we are trying to implement the Healthy Island concept. That's one of the important programs that we see that it will address all other public health programs as well, including malaria. So this program is something that we are now trying to deliver together with our partners, including the NCDC as well.